I'm going to talk to you about our osteoarthritis of the base of the thumb joint. This is primary osteoarthritis that affects this particular joint. The different types of osteoarthritis you need to be aware about is osteoarthritis and rheumatoid arthritis. Osteoarthritis of the hand commonly affects this basal joint of the thumb and also the tips of the finger. However, rheumatoid arthritis is more widespread and can affect many joints in the hand, but also elbow, shoulder, neck, and lower limb joints. Osteoarthritis of the thumb-based joint is extremely common. It can be associated with pain and swelling, and typically pain and swelling occurs either due to bad luck, or due to bad weather, or due to an injury to the thumb basal joint. In most cases, the joint is arthritic but not painful. In other words, it is in a state of remission, and there are thousands of patients with arthritis of their hands who don't even know they have arthritis, and it gets picked up when they'll come for x-rays for something else, such as a broken wrist. When you have a painful swollen joint of the thumb, you can have a splint applied to the thumb with anti-inflammatories to calm the swelling, and this will help settle the swelling and pain over a 6-week period. In some cases, when the pain doesn't settle with the splint and anti-inflammatories, we use steroid injections into the joint, which can be done in the clinic, and this can be highly successful. However, there are some patients who require more than one injections, and if they're having to have repeated injections in a short space of time, we end up having to do an operation. There are several operations described for this condition. The one that's most popular and time-tested is a procedure called trapeziectomy. This bone at the base of the thumb is called the trapezium and is severely arthritic in this condition. And what we do here is we take out the bone and repair the soft tissues around it. In some ways, you can think of it as a gift, and you open the gift wrapper, you take out the gift, and you close the wrapper. So within the space left within the gift wrapper, where the trapezium was, you get a blood clot that forms in the shape of the bone, and that gets replaced by scar tissue. And hence the operation is often very successful. About 80% of the patients who have trapeziectomy are delighted with the operation, and the other 20% might have a few problems that requires further help.